title of the impact of vitamin K2 and inactive vitamin D supplementation on vascular calcification in pediatric patient or regular hemodialysis. This study was a randomized controlled trial. Today we will go through the following items: introduction, aim of the study, patient and method, results, and finally conclusion. Let's start with our introduction. First, the pediatric patient with end-stage renal disease on regular hemodialysis commonly develop vascular calcification, which is associated with a high rate of cardiovascular mortality and morbidity. Vascular calcification can occur in both the intimal or the medial layer of blood vessels. However, the medial calcification is considered the most common and the major form of calcification in this category of patients. Also, it has been proved from various studies that vascular calcification does not result from just a passive deposition of calcium and phosphorus in the blood vessels due to their increased circulating levels. Recently, vascular calcification in end-stage renal disease patients has been proved to be an active cell-mediated process that involves the damage and the death of the vascular smooth muscle cells and its phenotypic transformation to osteoblast-like cell. Moreover, it has been recognized that the calcification inhibitors proteins are deficient in end-stage renal disease patients with vascular calcification. All this made this category of patients are at high risk for vascular calcification. From this vascular calcification inhibitor protein are the matrix GLA protein and the osteocalcine. They are called vitamin K dependent protein, and they are among the strongest local inhibitor of vascular calcification, acting in the vessel wall. They are both calcium-binding protein that precipitate in the organization of bone tissue and the vascular health. Both have a glutamate residue that are carboxylated by the enzyme called gamma-glutamyl carboxylase to be activated in a reaction that require vitamin K to occur. When there is a vitamin K insufficiency or deficiency, the uncarboxylated GLA proteins such as uncarboxylated osteocalcine and the dephosphorylated uncarboxylated MGP or the matrix GLA protein, their circulating levels increase, and this is associated with a poor bone and vascular health. Let's go through the importance of vitamin K and vitamin D. Vitamin K is a composite term. There are mainly two main forms of vitamin K, either vitamin K1, which is known as phyloquinone, found in vegetables, and either vitamin K2, which is known as a miniquinone, produced by the bacteria in the intestines and in the fermented food. Vitamin D is a fat-soluble steroid vitamin that is endogenously produced in the human skin or obtained from the diet that must be activated in a two-step hydroxylation reaction, occurring first in the liver, then in the kidney, to produce the active form which is known as 1,25-dihydroxycholecalciferol. Several studies have demonstrated that the end-stage renal disease patient, either adult or pediatric, suffer from vitamin K deficiency, which may be due to the potassium and the phosphorus restricted diet of the hemodialysis patient, and due to also the inability to take a sufficient quantity of nutrient because of the nausea and anorexia that suffer from this patient. Moreover, vitamin D deficiency is common in the hemodialysis patient because of the decline in the GFR and the reduce in the 1-alpha hydroxylase activity, which is required for the activation of the vitamin D, and also the effect of the increased fibroblast growth factor 23. Hence, this population is at risk for any consequences of poor vitamin K and D status. Previous preliminary studies focused on the beneficial effect of vitamin K2, which is called miniquinone 7, and the vitamin D supplementation in hemodialysis adult patient. In 2014, a clinical trial have demonstrated that the 8-week supplementation with vitamin K2 at a dose of 360 microgram in hemodialysis adult patient reduced the calcification marker in a linear and dose-dependent fashion. However, there is no previous studies investigated its efficiency and safety in hemodialysis pediatric patient. And so the aim of our study was to assess the effect of the vitamin K2 called menaquinone 7 and the cholecalciferol, which is a native vitamin D or the inactive vitamin D, supplementation on the circulating level of the calcification regulators, and also to assess their safety in pediatric patients on regular hemodialysis. Our patient methods. Our study was a prospective, controlled, open-label study. The method of randomization was permuted block randomized. This study was conducted on pediatric hemodialysis patients. They are undergoing the hemodialysis in the pediatric nephrology and dialysis unit in the Children's Hospital in Shams University in Cairo, Egypt. Our inclusion and exclusion criteria. For the inclusion criteria, we included in the study all the patient age from 6 to 18 years that start the hemodialysis in the last 3 months or longer and has a hemodialysis frequency of 3 times or more weekly. We excluded from our study, or our exclusion criteria was patient with life expectancy less than 3 months, patient taking warfarin, patient with known intestinal malabsorption syndrome, and also patient taking any vitamin supplementation that may interfere with the action of the vitamin K or vitamin D supplementation. This figure shows the design of our study. First, the enrollment. We assess 100 patients for their eligibility, and then we include in our study 60 patients who follow the inclusion criteria. These 6 patients were divided into 4 groups. Group 1, which is known as a vitamin K2 group, it contained 15 patients that take 100 microgram of vitamin K2 daily in addition to the standard therapy for 4 months. And then group 2 also contained 15 patients that administered the 10 microgram of the inactive or the native vitamin D daily in addition to the standard therapy for 4 months. And this group is called the cholecalciferol group. And also group 3, which is called the vitamin K2 and cholecalciferol group. It contained 15 patients that administered the 100 microgram of vitamin K2 in addition to the 10 microgram of inactive vitamin D, in addition to the daily standard therapy for 4 months. And then the group 4, which is called the control group, they are 15 patients administering only the standard therapy. The standard therapy of the hemodialysis patient, including taking phosphate binders, taking vitamin D, also calcium supplement if needed. Also, we include 50 healthy patients. They were enrolled as a normal control of age and sex matched for comparison of the serum level 3 marker, which is known as fibroplastic growth factor 23, and the uncarboxylated MGP and uncarboxylated osteocalcine. All patients were followed up till the end of the study, and there were no losses or discontinuation of the therapy. Finally, we analyzed 60 patients. Concerning the lab measurement, we took 5 millivenous blood sample. They were withdrawn from all the patients of the 4 groups before the dialysis session at the baseline and after 4 months of supplementation or taking the standard therapy. Then this sample were centrifuged for 10 minutes and then stored in 5 milliallocates for further analysis. We analyzed many lab values, including the fibroplastic growth factor 23, MGP, uncarboxylated 4, and uncarboxylated.
En plus, ils sont délicieux, ils sont cuits à la perfection. Et les femmes ne travaillent pas pour leurs enfants oui. Ah oui, oui, c'est pas des réfugiés. Enfin, il y en a certains, mais
osteocalcine and the 25 hydroxy vitamin D or cholecalciferol. They are all analyzed using the ELISA technique, and also we analyze serum phosphorus, calcium, parathyroid hormone, hemoglobin, platelet count, white blood cell count, creatinine level, uric acid level, BUN or blood urine nitrogen, alkaline phosphatase, aspartate aminotransferase, AST, and the ALT, and also we analyzed many lipid profile, including the LDL and HDL, and total cholesterol, and also the triglyceride. They are all analyzed using the standard laboratory technique. Our results. At baseline, all the statistical tests didn't find any significant difference between the four groups in terms of demographics and the clinical characteristics and the biochemical parameters. Also, the mean serum uncarboxylated MGP and uncarboxylated osteocalcine and FGF23 were found to be significantly higher in the hemodialysis patient as compared to the healthy normal control, which were took for only analysis of these parameters. At the end of the study, there was a significant difference in the uncarboxylated MGP mean serum level between all groups. And when we make a post-hoc test, the most significant reduction was found to be in the group 3 as compared to the other group. We found in the group 3 that has the most significant decrease in the level of the uncarboxylated MGP as compared to other groups. Also, the mean serum level of the uncarboxylated osteocalcine significantly differed at the end of study between all groups, and also by using a post-hoc test, it was found that the most significant reduction was found in group 3 as compared to all other groups. Also, group 4 didn't show any significant difference as compared to their baseline results, which take only the standard circle. Also, at the end of study, there were no significant difference between groups in the mean serum levels of the FGF23. However, there was a significant rise in the mean serum level of the FGF23 in group 4 as compared to their baseline result, and this is a bad result. Concerning the side effects, 4 patients in group 1 representing 26% and 6 patients in group 3 representing 40% complained of mild GIT side effect, including nausea, abdominal discomfort. Otherwise, there was no other complaint, and the medications were well tolerated, and no patients were withdrawn from the study due to the side effect. Finally, our conclusion: the pediatric hemodialysis patient had lower level of the vitamin K dependent protein as compared to the age-matched healthy control. Consequently, after 4 months of vitamin K2 and or inactive vitamin D supplementation, there was significant decrease in the vascular calcification markers, including the uncarboxylated MGP and the uncarboxylated osteocalcine, and this showed the potential beneficial effect of vitamin K2 and inactive vitamin D on the calcification regulators, and also it conclude that it may be very beneficial to take this supplementation for this category of patients for further beneficial effect on their health. Finally, our references. And finally, thank you, and it was very great pleasure for me today to present my topic. Thank you.